Hey guys, I have a great question today that I've been asked in many different forms from many different people over the past few weeks. I just keep getting this question in my inbox, and it has to do with pelvic organ prolapse and exercise. And I often hear from women who've really been into running or CrossFit or high impact interval training, kind of hardcore workouts, and they're saying, I have prolapse. My doctors told me I can't do these exercises I love, but what can I do instead because I'm freaking out without my exercise? So if you can relate to that, or if you've ever wondered what exercises are safe for you and what you should avoid if you have prolapse, then this video is for you. So first we'll talk about exercises to avoid, but first let me just tell you that it's really important to keep in mind that everybody is different and everybody's going to respond to exercises differently depending on their physical fitness level in general, their body awareness in general, and how well they've kind of connected into this area and they can tell, how much is too much or how much they can push themselves, and particularly how advanced their prolapse is. So if you have a very mild prolapse and you have really great body awareness and you kind of know when you've reached your limit and you've reached the too much point, then you're probably going to be able to push yourself a little farther than somebody else who may have a more advanced prolapse and or who just really isn't in touch with their body. And that's okay if you're at that level. If you're not really in touch with your body, that's totally okay. But you might want to be more careful and not push yourself too hard. So I hope that makes sense. It really is kind of individual, but I'm just going to give some general guidelines. In general, you're going to want to avoid pounding exercises that are really, really high impact and create a lot of downward pressure and strain on not only the joints, but also the pelvic floor muscles. You're also going to want to avoid crunches and sit-ups. Those two exercises put a lot of downward strain on the pelvic floor, especially if you're doing them without really focusing on engaging the pelvic floor muscles first and pulling in the low abs. If you're not focused on that, they can put too much downward pressure on the pelvic floor and are no good. In a similar vein, oblique crunches and bicycles, those standard kind of waist whittling moves, may need to be avoided as well for the very same reason, that downward pressure on the pelvic floor. Even planks, which can be okay for some people with prolapse, you need to be careful with them. In the high plank position, it can really utilize the upper abs, which can actually put a lot of downward pressure on the pelvic floor, especially when you're getting into the plank position. So be very, very careful. I have an alternative that I can show you at the end of this video that may be better for you. Although resistance training is super important for women, especially for bone health and all of that, depending on your level of prolapse, you might need to avoid really, really intense powerlifting and super, super heavy weightlifting. Now, I do have to say, I really feel strongly that most people with prolapse can still do resistance training if they're using light weights. And that's even with more advanced levels of prolapse. You just have to be very, very careful, listen to your body, and talk to your doctor if you have any questions or concerns. I do have a canned food workout, which uses very, very light weights, in other words, cans of food, and high reps, and it'll give you that resistance training. It'll help build lean, toned, strong muscles without the heavy, heavy weights that can cause a lot of downward pressure and strain on the pelvic floor. Okay, so let's talk about what you can do if you're just like missing your runs, you're missing your high impact interval training, burpees and star jumps and all that kind of stuff. You want to get your heart rate up and you want to get a sweat on, but you're worried about your prolapse. Well, you can still do cardio. I have actually a low impact and medium impact cardio workout that I can share in the notes below this video and also in the little information button somewhere up here. You can also consider, this won't be for everyone, but you can try seeing how it works for your body to jog the uphills, so run the uphills, and then walk the downhills and the straightaways. So usually when you're jogging on the uphills, It's kind of a quicker and lighter step. It's not so much pounding as can happen when you're going down the hill particularly. So you can experiment with running the uphill and walking the downhill and see if that works for you on your outdoor runs. You can also amp up your speed with speed walking. Of course, swimming is another great option, great for the entire body and a great position for your pelvic floor. And I've already addressed the great weight training option, which is using lower weights but higher reps. And again, I do have a video for that as well that you might enjoy. As for core strengthening exercises, there are a ton of wonderful exercises you can do that don't involve crunching, standard crunches or sit-ups. And I have a whole bunch of options on my YouTube channel, so just check them out. If you are going to experiment with crunches, just be sure to engage your pelvic floor muscles first. So do kind of a Kegel contraction and really pull in your lower abdominals as you're crunching up. So exhale as you crunch up as well. So again, if you're going to experiment with crunches or oblique crunches or bicycles or anything like that, be sure to engage the pelvic floor, pull in the low abs, and exhale as you crunch. But again, you might just want to skip those. Wonderful options for exercises include moves where your bottom or your hips is actually higher than your head. So this can be like a bridge exercise or certain moves in a downward facing dog position or a dolphin position. That position allows gravity to kind of pull your pelvic organs, your prolapsed organs, back into their rightful place and allows your pelvic floor muscles to really optimally fire because they're not being overly stretched or strained or taxed. Now, that being said, those aren't exactly functional positions. They're not really positions that you're using in your daily life. And so, you don't want to make that be the only core strengthening exercise you do where your hips are above your head. But at the same time, they're a great way to kind of, isolate the hip and pelvic floor and core muscles in isolated core strengthening exercises. Speaking of isolated core strengthening exercises, let's talk about that safe plank that I alluded to earlier. So what you're going to want to do is start lying on your belly, come up onto your forearms, and engage your pelvic floor. Lift your pelvic floor muscles toward your head. So squeeze and lift your pelvic floor muscles very gently, and then pull in your low abdominals. I call this zipping up, like you're zipping on a tight pair of jeans. You're going to hold that and you're going to exhale as you lift your hips very slowly and gently off the ground into a elbows and knees plank or a forearms and knees plank. You again want to make sure that you exhale as you lift up into that plank. You kind of lead with your bum, so lift your bum up. You don't want to make your bum super high. You want to be straight like a plank, but you really want to feel it deep in those corset, deep core muscles and hold it. You can come down and up repeatedly, really making sure that the action is coming from the deep core muscles, the deep hip, abdominal, and back muscles. And you're not just, lifting your bum up and down using your legs. You want to use your core muscles and again, engage from the bottom up, from the pelvic floor on up, and not from the upper abs on down, which can sometimes happen when you're transitioning into a full regular plank. When you are doing standing exercises, which are certainly more functional because we live most of our life standing up, be sure to focus on a great posture, nice tall posture with your head over your shoulders, over your hips, over your heels. Make sure that your lower ribs aren't popped forward. You want to pull them back, and you want to make sure that your head isn't jutted forward. You pull it back as well. So nice alignment is key, as is breathing integration. You'll notice that in a lot of my videos, I don't use music. This is partially because of copyright issues and finding great royalty-free music, which can be hard, but it's also in part because I often want you to hear my breathing and follow along with it. You really need to integrate the exhale with exertion, especially if you have prolapse. This is because when you are exerting, you potentially, if you're holding your breath or if you're inhaling, you could be putting excessive downward pressure on your pelvic organs. which then presses down into your pelvic floor, because the breathing diaphragm either is staying in place if you're holding your breath, not good. This is called the Valsalva maneuver, not good. Or it's actually lowering if you're taking a deep inhale and expanding your lungs. Your breathing diaphragm is lowering, and that's going to put downward pressure on your pelvic organs and thus your pelvic floor. So really integrate breath with movement and think about posture. That leads me to my next and really final kind of tip, which is that if you think about it, exercise really just makes up a small fraction, small percentage of your entire day. So when it comes to prolapse and preventing the progression of prolapse, it's important to exercise mindfully and avoid the exercises that I discussed at the beginning, and maybe incorporate more of the exercises that I talked about here at the end. But more than anything, it's important that you think about the little things that you do throughout the day that add up. So maintaining that good posture and alignment throughout the day, whether you're standing or sitting. Also engaging your pelvic floor as you come from sit to stand, and also as you go from stand to sit. Making sure that if your pelvic floor muscles are tired and you're feeling that strain and pressure from your pelvic organs, especially toward the end of the day, that you take some time to rest with your bottom up on pillows. Just rest and relax. Take that moment for yourself. You need to. You're healing, you're dealing with a condition where there's a lot of strain on the pelvic floor, and so you need to take care of yourself. So really think about and care for your body throughout the day. Think of this condition. Don't obsess over it, of course. Please don't fear movement, and don't let this become, the primary focus of your life. You've got more things to worry about and more things to do and more things to live than worrying about your prolapse all day long. However, do keep in mind the basic kind of lifestyle factors that do matter and do add up throughout the day, even more than your short exercise program that you do once a day. So I hope that makes sense. I hope that helps you. And if you have any additional questions, please ask in the comments below. I can help answer general questions. And if you have specific questions about your condition, or if you want to find out how far your prolapse has advanced, then you really should speak to a pelvic floor physical therapist or your healthcare practitioner who can help you out and is sympathetic to your needs. So thank you very much for watching, and please do check the video notes for helpful links and resources. And until next time, remember, eat clean, move every day, and you will shine brighter.